It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is healthcare, and joining me is Josh Magrini with Maxim Home Care Services and Jennifer Helin of Seniors Helping Seniors. Welcome, Josh.
Thank you.
Welcome, Jennifer.
Thank you.
It's always a pleasure to have you, Jennifer. You've been with me before. Josh, this is your first experience on the worldwide experience of TV. You ever been on a TV show before?
Not that I can remember, no.
Oh, now you can become famous.
Oh, a dream come true for me, Joe.
I'll tell you, just a quick story. I had been doing my radio show for about 7 or 8 years, and my wife and I went to one of the larger stores here in town, and I was buying some trousers at the store. And as I was paying the bill, the person said, "You do radio." He recognized my voice. So you never
you're saying
know.
There's a chance.
Yeah, you never know. So you have to be careful what you say.
Oh, that's true.
You don't want to mislead. I'm only kidding. But having said all the joking aside, Josh, first, what is Maxim Healthcare and what do you do? Because I want people to understand what both of your services do.
Sure. Well, we're a home health care provider. That means a lot of different things to a lot of different people. Maxim exclusively provides, I guess not exclusively, but we only provide private duty nursing, which means we have a nurse come into your home, stay for a shift, and we're able to provide all levels of care in terms of skill levels, meaning nursing RNs or certified nursing assistants. But all levels of care we provide in the home on an ongoing hourly basis.
Wait, you don't have nurses coming to home just say for an hour visit? Or you said so it caused me to think you're coming in for a shift.
Yes, that's correct. That's what we do. So in order for a nurse to come in for an hour visit, that would be something where it would have to be mandated by a physician. For what we're talking about here, our nurses, they would have to be in the home for a minimum of 4 hours.
Okay.
Mm-hmm.
So, okay, what else do you do then besides that? Or is that what you do?
That is what we do.
So you were talking to 8-hour services or 4?
4 hour minimum, up to 24 hours per day.
So you can provide round-the-clock care.
Absolutely. We do it very frequently, as a matter of fact. A lot of our patients require around-the-clock care.
You know, I didn't know that. I did not
know.
That. How long has Maxim been in existence in Brevard County?
In Brevard County, I believe our branch opened in 2000. But Maxim has been in operation since 1988.
But here, and all these years, and when people would ask us for caregiving around the clock.
We can do that.
I know, but I don't understand why Maxim never came to our attention. I don't understand that.
Well, could be for a variety of reasons. First, I would say around-the-clock care is awfully expensive. Very rarely will I encounter an individual who will pay privately for around-the-clock care. Also, in order to qualify for around-the-clock care, you have to have basically a letter of medical necessity from several physicians to your insurance company deeming it medically necessary for you to have those services even. So just because you want it doesn't mean that you can have it.
So Maxim services would be paid for generally by insurance?
Correct.
It could be long-term care insurance?
Could be a long-term care plan, could be like Bankers Life or something like that. Could be an insurance company such as Blue Cross Blue Shield, could be Medicaid, anything.
That's interesting. I've never heard of Medicaid providing around-the-clock services. I've never heard of that.
And Joe, honestly, it would be in a situation where the patient would have some type of a feeding tube inserted into the belly or a trach in their neck for breathing purposes, or on a ventilator around the clock. Those kinds of things, in order to have a feeding given into your stomach, right? This requires a nurse to be there.
Yeah.
You got to eat. So Medicaid pays for a nurse to be there, the 24 hours a day to administer feedings via a G tube or a gastro tube, or to administer medication via the same tube, or to change your trach that you have in your neck, or to suction as well.
Let me ask a question.
Sure.
If a person, and you kick in with what you might know on this, just play the devil's advocate. Medicaid is generally for poor people. And I have a hard time figuring out how a person that needs that kind of care would still be in their home and not in a nursing home, because that type of care was more costly in the home than would be in a nursing home.
And I think that's where I would say no. In order to,
I want to dispel that myth. That's
So let's talk about it. I mean, most definitely it's cheaper to care for a patient inside of their home with one nurse and one patient, as opposed to staffing a facility with 15 or 20 nurses and 15 or 20 patients. I mean, it makes sense for these insurance companies, and I think more and more they're getting on board with the fact that it is cheaper. And they're becoming, as it becomes more popular, our conditions for participation become more stringent. Our rules and regulations, in essence, become more stringent, which means we're monitored more closely, we're surveyed more often. That gives us, as we succeed in those surveys, hopefully, that gives us more, a better chance when we go to these insurance companies and say, hey, look, this is what we're doing. This is what we've done, and this is what we can do, but we need you to be on board with that.
Well, it was interesting because when I asked the question about both of your companies are not Medicare-type companies. No. It's private pay, insurance, and now you're telling me you both come out of the statewide Medicaid managed care program.
Correct. Right.
Well, you always learn something.
You do.
What do you do different than what Josh does? I'm going to get back to what he does, but what do you do?
We are kind of the first level of care for a senior. We are a homemaker companion care. So we're kind of our specialty, our niche is when someone first needs some help. They want to stay independent, they want to stay in their home, but they need a little extra help. They need help. Maybe they can't drive anymore. So transportation to and from doctor's appointments at the grocery store. Maybe they've got arthritis and cleaning is not good anymore. They have a hard time getting those sheets around the bed. So we'll come in, we'll do laundry, light housekeeping. We make meals. A lot of non-medical care that seniors need to be able to still, function independently in their home.
I know that I've had you on various radio shows and other TV shows where you've explained that you do work with the companies that are Medicare companies. You all can commingle the services.
Right. Yes.
So I think it's important in understanding, and what you're saying, Josh, and what I wanted to get back to was the fact that by being smarter about how we're using the nursing care service, that we're able to drive down the cost of the care.
It's not even close. Absolutely. In my opinion, it's, when you're talking about having a nurse in a facility care for these patients over 24 hours, you're talking a team of physicians, nurses, nursing assistants. Usually a respiratory therapist is involved, or an occupational therapist, or a physical therapist. The cost it would blow your mind. I'm sure you're familiar with it.
I am.
But when you get them in the home and you have all of these resources available to you at a fraction of the cost, honestly, I couldn't imagine it operating any more efficiently.
Okay, the reason I ask is because before you two even got involved in this business, I remember a case where a man had Lou Gehrig's disease. And he wanted to stay in his home. He was a retired Air Force officer. And the military paid an average cost of $288,000 a year to keep him in his home. That's what it cost. And I never understood why. I knew he wanted to stay in his home, but the real place, the obvious place, that was the case that should have been in a good nursing home. And
why do you say that?
Cost. This is, Josh, and this is it's a judgment thing, it's a call. But if we're ever going to drive down the cost of care, we have to be realistic. There are some cases that we can handle one way, some other cases may need to be handled another way. And I think that both of you are going to see those things if you continue in the home care business. Do you understand?
I see what you're saying. That, do you know off the top of your head, because I don't, what it would have cost to keep that gentleman in a facility for a year? It cost him $288,000 to be homebound. What would it have cost him in a facility for the year?
A nursing home would have been, at that time, would have been $40,000 a year.
$40,000 a year.
See, if unless I'm wrong, and correct me, if you're in a nursing home and you have Lou Gehrig's disease, is there different?
Yeah. So unfortunately, I'm not familiar with the with all that is involved with Lou Gehrig's disease. But what I'll say is, if Lou Gehrig's disease results in complications that mean you need to have a nurse, not a nurse assistant, follow you, which means you're not in a nursing home, you're in a skilled nursing facility, where that is much more expensive.
Which brings a point. I probably should not be discussing something like that based on the knowledge that I have, when there are so many other facts that enter into it, and which makes a good point for people understanding what basic home health care is, which is what you do, and at what level you enter the scene and the picture. Because if we're not, I think both of you agree, if we're not smart, we will never be able to make the dollars cover the cost of care.
Nope. That's
what it should be about. How can we make sure people have good care? And I like an example, Jennifer, that you gave, and I never tire of having you talk about this. Josh, describe for Josh and our viewing audience the one case that you and I have talked about, where the lady had a problem in the morning and what you did, and then it became a problem at night, and how you did what you did, and how that kept the level of cost about 1/3 of what it would have been in an assisted living facility and kept the family happy.
Right. Like I said, a lot of times we're there in the very beginning and develop a nice relationship with the customer. And in the beginning, we were actually only a couple of days a week, and it became over time 7 days a week, where we would go in the morning, give her a medication reminder. She had a nurse that did her pill box, and make sure that she had a good breakfast. She was, showered, dressed, ready for the day. She did all that on her own, but we kind of nudge, make sure that all of that was accomplished and she was ready for her day. And once she had that and had a good start to the day, she was good for the rest of the day. And we went on with that for about a year and a half, where she really did very well.
Just a couple hours in the morning?
Just a couple hours, just 2 hours every morning to make sure that she was, got her day off to a good start. But then we started to notice, and we talked with the family, that we would leave an evening meal for her and in the fridge, and she was not eating it. So we noticed a few things slipping. So we talked with the family, and the family said, yes, we're noticing these things too. So we would come in 2 hours every evening. Again, make sure she had her dinner, give her a med reminder, kind of make sure that the house was tucked in, doors were locked. She lived on the first floor, so we want to make sure all of the doors in her condo were locked up tight, and then we would be on our way. And we did that for about a year and a half.
So we're talking about 3 years of care.
Yeah, so we were able to keep her home where she was very happy. She, had people to socialize with because she lived in a condo association, and she functioned very well.
Yeah, but initially, what did that care cost per month?
Per month, oh gosh, it was under $1,000.
And by the time you were doing 4 hours a day, 30 days a month, it was roughly $2,000.
Yeah, a little bit less. Mm-hmm.
So for $2,000, the woman was in her home. The question that I think that you had to address and look at with the family was the safety issue. Was she able to remain in her home safely with the care that you all were giving? And as long as you can meet those circumstances, then that's what should be done.
Absolutely.
And this is a hard call sometimes, and I think this is. I still want to ask a question from you, Josh, about
Sure.
Maxim. Okay. You made a comment, and maybe I misunderstood you. Do you have a nurse doing this care, or do you have a CNA?
Both.
Yeah, both.
Depends on the level of care that's required.
Okay.
If there ever is going to be a nurse in a home, not a CNA or a certified nursing assistant, the nurse has to be in the home as mandated by a physician. So just because you want a nurse doesn't mean that I can just send a nurse.
Oh, it's got to be the doctor's orders.
Absolutely.
But would under your care system, would a skilled nurse be in the home 24 hours a day?
Absolutely.
Would?
Absolutely.
Holy mackerel.
If that's what you need, yeah, we're there.
So if you have a feeding tube or
Tracheostomy.
a tracheostomy, and you have to make sure the airway is clear and everything, it requires skilled nursing care.
Oh, sure.
Wow.
The feeding tube as well. In certain states now, but we're talking specifically Florida, but in certain states, a nursing assistant can administer medication and feedings via a G-tube or gastro tube. But in Florida, it's a nurse.
It's got to be a nurse.
It's got to be a nurse.
That's the other thing that's so important is that are licenses required for what you do?
Yes.
What kind of license requirements do you have to have, Jennifer?
We have a homemaker companion care license in Florida, and it is different in different states, like Josh said. So when we have people moving in from the north, it's important that they do understand that even in New York, where I'm originally from, upstate New York, their licensing is completely different than what it is here in Florida. So maybe when they're coming down and they're used to some different rules and regulations, they don't quite understand. Here in Florida, we definitely have very strict rules and regulations that we have to follow, and where maybe they could have had a CNA do the feedings up in New York, down here in Florida, that's not
Before
possible.
I ask Josh a question, how long did you live in New York?
How old am I now? I was there till about 23.
Holy mackerel, you do not sound like you're from New York.
Upstate New York.
They don't talk like
Not New York City,
okay. They talk
upstate New
different.
York.
They talk an American upper and upstate. Okay, all right. Okay, got that out of the way.
They're
What
mountain
kind of
people.
licenses does Maxim have, Joshua?
Our license, we're a home health care agency. We're licensed through ACA, the Accreditation Commission for Home Care. So we also have JCO accreditation, so our nurses can work inside of these skilled nursing facilities or hospitals. But our license is as a home care agency, home care provider,
Okay.
which gives us liberty to provide both skilled and unskilled services.
Okay. I know in your case, a doctor has to order certain things according to activities of daily living. But does that enter into yours at all, Jennifer?
It really doesn't, because we're not doing the medical and we're not doing the hands-on care.
Okay.
So we're not putting hands on. They can take a shower while we're there, but we're not helping them wash their hair. That's against our licensing.
But see, this is as important for people watching this show to understand that if what you do is sufficient to care for their person, they need to be cared for. Because too often, families jump to levels of care they don't need, or conversely, they try to do something with a level of care that's not safe. And here we get into where family members try to care for other family members when in fact they should have services like yours.
Mm-hmm.
Right.
And how do you encounter situations like that, Josh, or how do you do that?
Well, you know, on the medical side, it gets very touchy-feely, especially inside of a home. You deal with a lot of interesting dynamics when you send a nurse into a home. Anytime there's a patient residing inside of their home who requires medical care, they have to have a designated individual that can care for that patient when we are not there. And the reason for that is because we employ humans, and human errors happen all the time. So there could be a time when our nurse gets into a car accident on the way to the home and she can't be there. In those cases, there has to be a designated individual who can care for that patient when Maxim or somebody else isn't there.
If Maxim's not there, you have to have can a family member be designated? You have to do that in writing?
Must be designated. A family member must be designated.
What kind of training would they receive? Would they receive training from you to do what you...
Absolutely. And most often, they receive the training within the hospital or skilled nursing facility that they're being discharged with the equipment or that they're going to have, right? So, Joe, you go to the hospital, you come home, you're going to have a feeding tube for the next month. Before you go home, somebody will leave the hospital with you knowing how to administer the feeding, right? Then you'll call Maxim and say, I need a nurse 12 hours a day to help me with this feeding.
Would family members be qualified to do something like that?
I've done it as a family member before.
You've done it?
Mm-hmm. With a feeding tube. That was in upstate New York. But
Right.
and for family members, there are family members who could do it, and there are family members who couldn't do it.
Who could not do it.
Yeah.
That's what's
it's a very personal thing. So having a company do it is really helpful.
Yes.
Well, that's why, I think that's why it's so important to have shows like this about home health care, because I think there are too many myths that cause people to elevate care to levels that are not needed when in fact family members can be trained. And I know that your clinical director, Nancy, has often said on different shows that one of the jobs that the nurse has in the home is to train the family member to do these things safely. That's the other benefit of having organizations like yours come in and do these services in the home, because the primary job of that nurse is training.
Yep, we just did it for an individual. We just spent 2 weeks going to his home every other day. He came home from the hospital with a tracheostomy, right? And he needed to learn because his family didn't want to have a nurse in the home 24 hours a day. You know, it was too invasive for that family. So we get that. We send a nurse to his home for a couple hours every day to work with him and the family member about how to care properly for his tracheostomy. We stayed for a couple weeks. He called me and said, "Hey, Josh, you know what? I'm good. I get it. So I don't need the nurse anymore." I said, "Okay, fabulous. Congratulations. We're done." And discharged him, and him and his family are caring for his trach until he no longer needs it.
Well, we're almost out of time, but I want to ask this question. You got methods of payment for both types of care. Private pay, I understand, and both of you take private pay. Right. But you also mentioned the statewide Medicaid managed care, and you both are qualified for that. But let's get in a case of long-term care insurance or other insurances. What kind of insurance would pay for your services, Jennifer?
Long-term care insurance typically will.
Long-term care? And
Yep.
how about,
Same here. Long-term care insurances will pay for our services. They'll usually cover 4 or 5 hours a day. They have a maximum daily benefit that they'll pay out, and based off of your agreement with that payer source, that maximum daily benefit will equate to X amount of hours, right?
I got my long-term care policy out the other day, and I realize I do not read Greek. And I'm going to have to get somebody to explain some of that to me. I think it's very important that people watching this show understand that we all need to understand what's in those policies line by line, because too often families don't realize that they could receive care and it would be covered. And I've got a situation personally, I think that my long-term care policy might pay for something which I need to have done, but I'm going to get that thing out and take a look at it, and if I can't figure it out, I'm going to call the company and ask the question, which goes back to the basic thing in healthcare. You need to ask questions.
You absolutely do. And these long-term care providers, these insurance companies, these managed Medicaid providers, they all have a team of nurses and physicians that they employ at their office who are available for you to answer questions.
That's good.
Yeah.
Oh, learned one. What would you offer as advice?
Definitely, read your policy, be familiar with it, and ask a lot of questions. We've dealt with several people with long-term care insurance policies, and each company's triggers are a little bit different. So you want to know when your policy comes into play, and
yeah,
that's important.
Yeah.
I know we're going to wrap it up, Joe, but the ADLs, the activities of daily living, for these long-term care plans, if you can't do 2 or more, most of the time you're a go.
You qualify for it? So important. People need to ask questions.
They do.
They need to ask questions. Well, we're just about out of time, and I want to go on the clock as saying I enjoyed having both of you today, and I hope our audience has learned something. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.